Doctors of Reddit, what are symptoms people should really visit a doctor for, but often don't? Paramedic here. I am going to say this. It might seem obvious, but you have no idea how many patients I see with this issue. Chest pain. If you have bad chest pain, you should see your doctor. Yes, it is true that it may just be gas, but I have seen too many patients with a heart attack that had an onset of symptoms 3 days prior. Too many with pneumonia that is a month old. There is a myriad of what it could be, but better safe than sorry. I'm not saying a 20-year-old active guy is having a heart attack, but it could be a pneumothorax, hemothorax, pleural effusion, aortic dissection, pericarditis, broken rib, pulled muscle, etc. Just get it checked out. Disclaimer, not a MD. Also not suggesting that if you slept on your remote control and have pain on that spot you're having a massive heart attack. Use your head. Optometrist. Anything sudden. Flashes of light. Double vision. Decreased vision. Pain. Redness. Headaches that are persistent can come from eye strain, so have it checked off of the list of many things that causes headaches. Sudden neurologic changes. Slurred speech. Limb numbness, etc. Many strokes can be treated with medicine, but only within 4.5 hours of onset of symptoms. Watch your poop, people. It tells you what's going on inside. I've had patients offhand tell me it's yellow, that they poop 12 times a day, that most of their poop looks like blood, or that they haven't pooped in weeks. Doc, blood in your poop means doctor, people. For a sense of normal, most people poop around once daily, so if you poop a few times a day or once every 2-3 days, that's still fairly similar. Not necessarily healthy or unhealthy, but if your poop habits differ drastically from that, you should get it checked out. Also, if your poop suddenly turns white or colorless, that's really bad. Doctors are too busy for Reddit, but since my dad is MD, here's what I've learned from him. 1. Go to the doctor if your bowel movements are consistently green for a week or more. This could be a staph, thanks for the spell check, infection or worse. 2. Pay attention to the shape of the moles on your skin. If they appear discolored or unsymmetrical, this is a bad sign. Moles like this have the potential for skin cancer. 3. If you're bleeding dark red out of your anus, something is wrong with your intestines and digestive tract. Thanks again for spell check. 4. If you're coughing for more than 2 weeks while huffing and pains from the chest. If you don't catch bronchitis early on, it can turn into pneumonia. 5. If your throat closes up for any reason, you're having an allergic reaction to something that could be potentially lethal to you. Take a Benadryl or 2 and get to a hospital ASAP. 6. If your heart is beating at an irregularly fast speed like it's going to come out of your chest. I don't mean because of something emotional. 7. If you have repeat sun damage and a mole sore appears and won't go away. Sometimes it can look as though it has a scab on top. This is cancer. 8. Intense dizziness and blindness all of a sudden. This could be many different things. 9. If your pee feels like needles when it comes out. That could be a UT or an STI. Either way, you need to see a doctor if it doesn't stop in a 24-hour period. That's all I've got for now, off the top of my head. Edit. I think mental health goes undiagnosed and untreated a lot too. Major sadness in conjunction to moodiness, focus issues, traumatic childhood, oversleeping, sleep deprivation, addiction, rape, molestation, hallucination, etc. These issues don't go away on their own, and in some cases time doesn't heal them unless there's professional supervision. Paramedic here. If your throat is closing up, call 911. Most if not all agencies in this country carry epinephrine, the only emergency medication that will temporarily reverse anaphylaxis. Taking a couple Benadryl is not a good idea for 2 reasons. 1. Oral medications take a while to become effective. 2. You may not be able to swallow a medication with swelling. Just call 911 and get the EP. I know this thread is about alarming physical symptoms, but from my experience as a GP, people are usually very good about coming in for anything that doesn't feel right about their bodies. But here are the often subtler, symptomless diseases that I wish people would be more proactive about. High cholesterol, high blood sugar, high blood pressure. These are risk factors for heart disease, which kills more people in the US than all cancers combined. A lot of people have them elevated and don't know it. Get them checked. Yup, I'm going to have every single symptom listed here. I'll be dead by the end of the day. I checked WebMD and it said you have network connectivity issues. There are really way too many potential symptoms to list, but to add a few. 1. Heart attacks can often have subtle symptoms, especially in women. In addition to some of the more common symptoms, shoulder neck arm pain is often an ignored symptom. Anxiety, insomnia, indigestion, dyspnea with upper trunk pain should not be ignored. 2. The 4F's fat. Female, 40, fertile, be on the lookout for gallstones. Right upper abdominal pain is a sign you should see a doctor if you fit the criteria. 3. Vision changes. If your vision is getting blurry or changes, do not assume your eyesight is going bad as a result of aging and avoid checking it out because you don't like the idea of glasses contacts. Changes in vision may be a symptom of very serious diseases. I shouldn't have eaten Taco Bell for lunch. I think I'm having a heart attack. Depression. Please, go see a doctor. Any trouble pooping? Any pain while pooping? Any blood while pooping? My brother had colon cancer start developing when he was 16. Take any issues seriously and get that crap checked out and get a doctor's finger in your butt ASAP. Crap, I'm a girl and got a pile at 11. I've never had it checked out. 9 years later, I've just ignored it and thought, oh, I'm too young for it to be anything sinister. We'll be going to the docs ASAP. Clogged hair follicles. Pause. If you ignore one long enough, it can turn into a lovely inch-long horn. My family is bad about going to the doctor. Reddit, where normal folks go to turn into hypochondriacs. You spelled WebMD wrong. You could type in symptoms for a common cold into WebMD, and it will say you might have cancer. Not a doctor, yet. Urinary incontinence in women. A lot of women think that leaking a little after a cough or sneeze, or needing to rush to the bathroom frequently, is just a normal part of life, something to put up with. There's actually a huge range of cool treatment options. This has been an interesting exercise in the limits of how much medicine I'm comfortable talking about on my public account. I'm a 4th year med student. I don't know any of your circumstances, and you shouldn't take medical advice from the internet. That said, there's an interesting phenomenon by which unlicensed people have more liberty to give medical advice online, because they have less risk in doing so. It will be interesting to see how that changes over the next decade. In line with women's health, abdominal pain should be checked out as well. It can be as benign as a bad taco to something more serious such as an ectopic pregnancy or anything in between. This may be obvious, but jaundice is never a sign of good things happening. It'll start with the whites of your eyes and face and move downward as things progress. Get it sorted. Not a doctor, but having burns around the leg area for being negligent around heat sources during winter. I would just like to add that you should see your doctor once a year regardless of symptoms or no symptoms. Hypertension has no symptoms and will kill you. Early onset diabetes is also often symptomless and you can do something about it if you are aware of it. Ugh. My husband turned 30 last year. I'm 28 and have recently decided we need to start doing this. I see my gynecologist every year but never my GP. Personal experience. Cramps in your calf that feel like the tail end of Charlie horses. Constant throbbing. Feeling as if a hot bath or cool surface could make them go away. That pain turns into foot pain. On the top of your foot that feels like you broke something or dropped something heavy on it. A red spot on the top of the foot. Pain when walking. Feeling like you need to elevate the foot. These are the only symptoms I had. The foot pain is finally what made me go see a doctor. I had deep vein thrombosis in my leg, or blood clots. 2 very deep ones and a smaller superficial one. My leg was actually so swollen they couldn't find a vein with the heartbeat. I had to be put on blood thinners immediately. 2 injections right in the stomach twice a day until my levels could even out and I could go on oral blood thinners. I was told it was already risky, but had I waited any longer, they could have dislodged and caused a stroke, a heart attack or a pulmonary embolism. Good advice. One step further, I barely survived a pulmonary embolism. My symptoms were sweating, coughing up blood, a temperature and a feeling of very high anxiety. I was on a long flight with a cast on my leg. My wife demanded that I go to the emergency room. I just wanted to go to bed. Probably wouldn't have woken up. Not a doctor, but a clinical researcher. One that I didn't really appreciate until recently. Insomnia. Go see a professional and get that crap under control. It has not been appreciated until recently that controlling insomnia very often reduces symptomatology of comorbid conditions, anxiety, depression, for example, or conversely, that uncontrolled insomnia will worsen those conditions. Hypochondriac powers. Activate. Egyptian 5th year med student here. I think it has to do with the different cultures. Here in Egypt, going to the doctor is the last resort most of the people would think of, and they often don't consider any of their symptoms serious unless they stop functioning. We've seen that guy once who's had diabetes for years, never got treated, started going blind, still went on, injured his foot, got gangrenous, and I believe the term auto-amputation is what occurred. Then and only then he decided that it might be a good idea to see a doctor. We have the same issue here in the US. With a certain type of people, we refer to them as males. As someone with generalized anxiety disorder, I should not have visited this thread. The biggest thing to watch out for is that sorta exhausted, a little strung out feeling. Having intermittent episodes of it is a sign of lupus. Attention hypochondriacs. Exit out of this thread immediately. Human bites. Sleeping during the day, aversion to garlic, sudden thirst for blood. Dark urine could mean kidney failure or dehydration. Drink water, people. For all those saying bleeding from the anus, yep, I actually just got hemorrhoid rubber band ligation performed on me yesterday morning. I'm sitting here on Vicodin right now, so bear with me. Unbelievable uncomfortable pressure from the bands. Not fun. Started as a child actually. I noticed I had what looked like a little blueberry on my anus when I had to be 11 or 12 years old. Years later as a teen I had some rare and intermittent bleeding during bowel movements I attributed to constipation. I never realized you weren't supposed to forcefully push out when having a BM. So those bad habits along with genetics progressed, of course. I would have to wash my butt with water every crap because toilet paper couldn't do the job on a disfigured butthole. LOL. I'm now 27 and can't remember the last time I didn't bleed from pooping. It didn't bother me a couple years ago until the internal hems got so bad. They would actually prolapse if I was standing for a very long time due to gravity. To make it worse, they would then bleed down my leg. You might be thinking, WTF is wrong with me, why did I wait so long? Yeah, I'm kicking myself for not getting it taken care of sooner, but is there a more embarrassing issue you can think of? Having doctors and nurses, hot ones, FML prodding your anus? LOL. Anyways, I had enough because it was affecting my general life. I'd have to schedule things around bowel movements because it would take a few hours for the hemorrhoids to suck back into my body. I cancelled dates. Had to take breaks walking distance, I would tell people, because of my back. Never had pain from them, which is also another reason I ignored it for the most part. But after a while I had to get it done. I'm just really hoping for a proper recovery. Why? Because I'm in a lot of pain. And hopefully they fall off soon. Medical student. I want to start off by saying mental illness related symptoms, especially in terms of high pressure and stress, especially when you don't notice a change but the people around you do over time. Although we often overlook incredibly stressful periods in our lives, they are a precursor for some mental problems. Not taking anything away from counselors, psychologists, but a psychiatrist, MD, is the best option for anyone suffering from severe mental stress pressure issues. Before such an option, however, it is recommended to visit your local schoolwork counselor if it is of access. If there is one thing to learn, it's the signs and symptoms of stroke. Fast, facial weakness and arm weakness and speech difficulty equals time to act. Others include numbness in face, arm, leg, dizziness, blurred or no vision, headache, difficulty swallowing, any lump, no matter how small, near your armpit's breast, especially for women. For breastfeeding women, lumps near that area are normal but should usually subside. Sometimes women can get permanently swollen breast tissue, which isn't an issue, but make sure to get any lump checked. Swollen lymph nodes near your armpit's neck. If you have no symptoms, but feel hardened lymph nodes near your neck, get that checked out ASAP. Black stools, specifically a tar black color, bleeding from digestive tract esophagus. If you feel tired all the time, especially if you do not eat much red meat, get a blood test. Anemia. If you are always thirsty, extreme. Diabetes. If your day consists of moments of sudden extreme fatigue and sudden sugar rushes, diabetes. Any moles that are not symmetrically circular, elliptical and are of black-brown color. If a mole is cancerous, it changes size quite rapidly, noticeable over several weeks, months. Moles which have grown gradually over years are not much of a concern. Common one. But any discharge pain whilst urinating. UTI. Heartburn, chest pain in normal situations. That is, separated from meals or emotional triggers. Increased resting pulse over a long duration. Weeks, months. Thyroid issues. Just something off topic. If you are hungover, do not take paracetamol. Out of all painkillers, paracetamol does the most harm to your liver. Mixing that with alcohol metabolism can cause severe damage to your liver. Rectal bleeding, loss of height, sudden blindness. If you start turning yellow, the color, not the race. If your facial bone structure starts changing. If you have profound mood or behavioral changes, it could be hormonal. If you pee a lot even when you don't drink much water. If your urine is frothy, one time could just be a fast pee stream, but frothing could also mean protein in your urine. If you just have a fever for an extended period of time. If you start turning yellow, the color, not the race. Head, desk, skin and eye yellowing specifically. If you pee a lot even when you don't drink much water, especially if you're also eating and drinking a lot. A nurse here, an easy trick for emergencies, ABCS. Airway, breathing, circulation. Are you having shortness of breath, throat closing up, noticing your limbs swelling or changing color, or new onset numbness or tingling that isn't otherwise related to a pre-existing, non-emergent condition? Circulation can also be read as cardiovascular. Chest pain, chest tightness, rapid heart rate, high blood pressure, again, higher than normal for you if you're hypertensive at baseline. Headaches unrelieved with OTC medications and no previously diagnosed migraines, vision changes or vision loss. ABCs can be helpful, but to the average and trained medical personnel the bottom line is this: if you're concerned about it, call your primary. They might suggest you come in and get evaluated. You can try OTC management if appropriate, but any signs or symptoms of heart attack, severe respiratory distress, or stroke need to be treated immediately. As much as I see hypochondriacs coming in, I'd much rather treat someone and rule out a major life-threatening diagnosis than have someone lose function and quality of life because they didn't think it was important to be seen. I read that in Billy Mays' voice. Don't know why. My name is Dr. Mundo and people should visit me when they are feeding. My wife is a surgeon. Don't ignore occasional incontinence as an adult. It may point to spine problems or something else serious. See a doctor. It can get significantly worse without treatment. I am currently working toward a PhD in a social science, and I have to say that the biggest issue I see is people who need mental health advice, help, and do not seek it out. I have been to therapy myself during a particularly trying time in my life, and it was one of the best things I ever did. It's amazing what having someone on the outside to talk to accomplishes. I also think that, when speaking to a stranger, you can vocalize more what is actually wrong or bothering you, less fear of being judged. Abnormal amounts of sadness or anxiety are both symptoms that can be worked through with a mental health professional. Pussy doc here. Ladies, if while fricking you feel a sudden pain like a real bad period or like someone just kicked your yoo-hoo, it may be embarrassing and maybe it feels almost like an Advil can take care of the pain. But now girl, you gonna wanna visit your doctor. If you have a cut or wound or even an ingrown hair that may be infected, and you start developing a fever, chills, or night sweats, go to a doctor and get some antibiotics. Too many people ignore the connection and think, oh, I must be coming down with the flu or something, and what could have been treated with a simple course of oral antibiotics ends up requiring surgery, IV antibiotics, and or an overnight hospital stay, and that crap's expensive. I am absolutely not a doctor. However, in listening to a podcast this morning, an actual doctor made a great point about head trauma. Even in acute amounts, it can cause a drop in testosterone, which can lead to a lot of problems, like depression. My girlfriend gets lumps in her armpits and says don't worry, it happens all the time when I tell her to get them looked at. Dodgy. Postmenopausal bleeding. Even spotting. It is often the first sign of endometrial cancer. It's generally caught early because of bleeding. When it is easily cured. Yes, the gynecologist will do an endometrial biopsy and it will be uncomfortable. And it will probably come back normal. But it could also save your life. Blood in your urine. Get it checked quickly. It could be something simple like a UTI, but it could be much worse, so please do check it out. Lung doc here. Mainly deal with lung cancer. First 5-6 points are for all you smokers. Also work in IQ. By the time you get there, you're sick. Like sick. Weight loss for no clear reason. Night sweats or fevers for no clear reason. Headaches that don't resolve or are associated with visual issues. Loss of consciousness. Cough that doesn't resolve. Change in cough. Change in sputum production. Coughing up blood. Change in shortness of breath while walking around. Skin color changes. Mole spots changing. Fast heart rate. Fluttering feeling. Leg swelling. Urinating a lot. Bleeding out a dong. I think more effective than trying to go through every single symptom for the Danger Will Robinson emergencies, which can encompass every single symptom you can imagine, from head to toe. It's more important to know this. Call your doctor's office and ask them. If you've noticed a change in your normal health status or bodily function, call your doctor's office. Ask them if you should be seen or not. If it's after hours or you don't have a primary care doc, use your health insurance or locality's nurse line. These are experienced nurses, usually emergency with triage experience, who are able to talk you through your symptoms and determine the best course of action for you. That might be the but it could just as easily be an urgent care or waiting to see your physician the next day. The biggest problem isn't that people aren't being seen, it's that they're being seen at an inappropriate level of care at an inappropriate time. They're coming to an because they've thrown up one time right before coming to the or they're waiting all weekend to go see their primary care doctor for right-sided weakness and slurred speech. Use those professional resources that are there for you. If your vomit is very dark, or has a coffee grounds texture, go to the hospital immediately. Unless you have recently eaten coffee grounds, you are likely experiencing some kind of internal bleeding. Let's have some genitalia specific ones. Men. Balls hurt. Balls have a lumps. One shrinks, grows. Peeing or ejaculating blood. Erectile problems. Penis develops lumps or patchy discoloration. Needing to pee more often. Difficulty initiating peeing. Dribbling a lot towards end of pee. Women. Change in discharge smell. Lumps growing on vulva. Discoloration of vulva. Painful intercourse, with both shallow and deep penetration. Change in periods, getting more heavy, but also irregular, longer etc. Bleeding between periods. Bleeding after menopause. If you think something might be stuck in vagina, it happens. STIs. They can lead to serious long-term damage. Don't be embarrassed if you think you have one. Increased feeling of bloating. Reduced appetite. Feeling full halfway through meals. Examine breasts for lumps too, and if you find one, get it checked. Also, men can get breast cancer. It's nowhere near as common, but it takes literally 3 seconds to check, so might as well get into the habit of it while you examine your balls regularly too. You have been visited by the Wealth Rat. Subscribe in 12 seconds and he will share his wealth with you. Like and subscribe, you magnificent person.